The situation in Guyana, as of yesterday, 1st April 2020, is changing dramatically. The number of confirmed cases remains at 19, with 1 inconclusive. However, our new deaths on April 1st, 2020 were 2, bringing the total number of deaths to 4. Of the numbers above, the regional breakdown is as follows: 1 in Region 3, 17 in Region 4 with 1 inconclusive, and 1 in Region 6. The total number of persons who have been tested has moved from 70 to 75, with 19 positives, 55 negatives, and 1 inconclusive. As of yesterday, calls to the COVID-19 hotline moved from 1,142 to 1,252. I wish to inform you that regions 2, 7, 8, 9, and 10 now have COVID-19 hotlines. Ladies and gentlemen, yesterday I provided you with the various scenarios for which testing is done. I wish to repeat that the Ministry of Public Health continues to follow the testing guidelines provided by the World Health Organization, which are as follows. Allow me to explain as simply as I can. Anyone presenting fever, along with one of the symptoms, shortness of breath or a cough, does not mean that they have COVID-19. What determines a person being a likely suspect is if that person, and let me give you the various scenarios. Scenario 1, if you have traveled and during the 14 days you begin to have a cough, fever, or shortness of breath. Scenario 2, if you have been in contact with someone who has tested positive for COVID-19 and during 14 days since that meeting, you begin to have a cough, fever, or shortness of breath. Or scenario 3, if you visited a facility where COVID-19 positive cases have been identified, and during the 14 days after that visit, you begin to have a cough, fever, or shortness of breath. Or scenario 4, in order to protect our patients, all hospitals will have a mandatory test done on patients to be admitted. With all the symptoms, cough, fever, shortness of breath, that cannot be explained from a clinical perspective. Ladies and gentlemen, these are the persons who were tested at the National Reference Laboratory, the only certified lab to conduct COVID-19 testing in Guyana to date. For those persons who are contacted for information by our surveillance team, we are pleading with you to please give accurate information so that we miss no one who should be tested. The number of persons in institutional quarantine is now 31. 11 persons are in isolation, with 1 person hospitalized in the COVID-19 ICU unit. The number of persons currently on home quarantine known by the Ministry of Public Health is 121.